Hi, Lorraine.
Hi, Marnie.
Hey, how are you?
I'm good.
You're already seated. Perfect. How have you been?
I've been fine, thanks.
Good. Did you hear the rain last night?
Yes. Who didn't?
I know. Actually, I slept through the whole night.
Did you?
Yeah, it wasn't even that bad. No. So you got to, well, we're doing a few things today. We're working up in your top right.
Yes.
I don't know if you remember when
Yes.
Bob went over it. We got, I think, 2 fillings to do and then a crown prep. We're going to prepare that
Yes.
tooth today. And I don't know if he explained to you, it's a 2-appointment procedure.
Yes.
So today we'll prepare, and when you leave today, you're actually going to have a temporary crown on there. And then it takes about 2 weeks, and then you'll come back. We'll actually remove that temporary and put a permanent crown in there today. But your fillings will be completed today.
Okay.
So we don't have to redo that. You're going to have a little bit of freezing.
Okay.
So now, any changes in your medical history since you were last in? No changes
No.
that way? Anything, no tooth concerns at this point
No.
anywhere else? Okay. So I'm going to put a little bit of numbing gel up there on the gums, and then Bob's going to pop in, and we're going to start the freezing
Okay.
for you, okay? It's supposed to be a little bit of raspberry. I know nothing tastes too great here, but put a little bit of that numbing gel, and I'm going to actually, just going to put a little gauze up there. You can actually close up if you like. Perfect. That's it. Now, I can't offer you the TV today because you won't be able to see there, or the window open.
Okay.
Yep, you're good.
We'll just sign that. Just keep rolling.
Now I'm going to let Bob know you're here, or maybe, oh, he's already here, Lorraine.
Hey, Lorraine.
Hi, Bob.
How are you?
I'm good. How are
Glad
you?
to see you. Did you come in with this in there? Can I take that out? So Marnie's already been with you. You're not worried about today, are you?
No.
How's your summer? Okay.
My summer's good.
Is it?
Mm-hmm.
All good. So you ready for me?
Yes, I am.
So we
I'd like
talked.
to get this over with.
We've done this before. Marnie, did you go over?
I did
the-
explain the
Okay.
procedure,
So
and
you're
it's a
gonna leave here today
2
with a temporary on the tooth, and the fillings while you're frozen will be done up there. So it's a good way to do it because we're going to control the shape of the fillings, and then when the crown's done, they'll be the perfect shape for the crown. And it's all to one side, on the top. There's no doubt. And you remember before how we wiggled you out when we freeze you and all that stuff?
Yes.
Which is good, important. Yeah. Okay, so let's put you back. So let's put you back. And thanks for letting us tape you.
You're welcome.
Even though I surprised you, and I know, I'm sorry about that, but you're a trooper.
Oh, well, I'm glad you didn't tell me. Or
Really, you wouldn't have done it.
yesterday or.
Oh, really? You would,
No.
you'd have been like, ah.
Wouldn't have been able to
Well, we
see.
weren't originally going to because we taped somebody earlier in the day that we did tell and they were fine. But then we saw you come in with a crown and we've been doing this for so long, I thought if you could, it'd be great. It's not going on Kojako or it's not,
Okay.
maybe CNN if we're lucky, but no. So it'll all be good. So really, I'm not, and I'll do just as good a job as I normally do.
Good.
Okay. Okay.
I am going to get you to slip these glasses on, Lorraine, just to protect your
So Lorraine, what we'll do
eyes there.
first is we'll wiggle some freezing in, and then Marnie's going to take that impression for the temper. If you remember how we do that?
Mm-hmm.
So let's go ahead and do it. Head towards me, Lorraine, just a bit. That's great. Head towards me just a touch. That's awesome. So Lorraine, I'm going to talk a little bit when I'm doing this. So a lot of shaking, if you remember, and just kind of. I go slow when I do this as well. It's much better. Any troubles?
No.
Doing awesome. Excellent. So we got one more spot here. You okay?
Yeah.
You're doing awesome. So when we're doing this injection technique, lots of shaking, Lorraine. Always important to be in touch with the patient because really what we're doing here is trying doing this without hurting, obviously. You okay, Lorraine?
Mm-hmm.
So I'm always asking for feedback from Lorraine. And the shaking really is a great distracting technique. So as I'm doing this, I use a great needle, very sharp, the new Septident needles. But what I'm doing is I'm very gently just introducing the anesthetic without distending the tissue. Very gently moving the anesthetic in. I use an articaine, which really has great penetration. Been using it for probably 20 years. It really works well. And I talk the whole time. So talking is a distraction as well. So by the end of it, you can see how slow I'm doing this. Lorraine, you okay?
Yeah.
And it really works well. And if you've ever had a terrible injection as a kid or even as an adult, which most of us have, This is something that's going to really keep patients loyal to you. So that wasn't too bad, I hope, Lorraine. Was that?
No.
Okay, so the injection's done, and we'll get you a little water here. Lots of water here. Awesome. So Lorraine, do you need to rinse?
Sorry?
Do you need to rinse after that?
No.
Not at all? Okay, so let's sit you up. Marnie's going to go ahead and take that impression for you now, Lorraine, if that's okay. So you did great with that. Okay, and I'll be back.
You don't have to go all the way up there. So I'm going to be taking this little impression. We're going to be using it again at the end.
That's okay. Yeah. You can. They'll turn off this. This is really my.
You've had this, you've done stuff like crown
had a-
stuff
yes.
before where you have it. So
Yes.
that little bit of a material, it's called an alginate impression. Just a little kind of a putty. But once it hardens up, then it'll make a little mold of the tooth the way it is now. Now remember, your temporary, when you leave today, is going to be shaped, not like your permanent one. It'll be similar to what your tooth was when you came in today. It's just really, it's enough just to protect the tooth for a couple of weeks till we get you back. So big as you can. I'm going to line this up here. I'm going to actually get you to bite right up into that and kind of hold your teeth still. Yep, just like that. It takes about a minute. And you're going to feel it kind of set up around your tooth there. You okay? And then if you do want to rinse once that's done, you can come over and have a rinse. I know it makes a mess. You're doing great. Be professional by the end of this, eh? All Bob's instructions and stuff. So you don't think you would have slept if you had known? You would have been all worried about it, eh? That's funny. That's almost ready. Perfect. I'll actually get you a cup here. And we are going to probably be using, and we may be using a rubber dam on you. I don't know if you've ever had one of those before. Possibly. I have one out ready if in case he wants to use one for the, just to prepare the teeth. Almost ready. That's probably good, Lorraine. Open just a little. You're going to feel a little pull here. Perfect. Excellent. Are you okay, or do you want to rinse?
I'm fine.
Okay. So what I'm doing actually is just trimming up a little of the excess alginate that we won't need. So when we put that back in at the end to make up our temporary. And that's it for that. Yep. You want to pause? You can pause again. Sure.
Right in front of the
Where
white.
does it go?
Right in front of the white.
Like in front of this?
White. The white tray.
Oh, in front of the tray?
Yeah, over top of it.
Oh, okay. You explain it again, or just show?
Tell me what you're doing.
Oh, just,
Keep your hands where they are, though. That's great. And over it.
yeah, so once I took the impression, a lot of it, usually a lot of excess will squish out. And so I just kind of trim it around so when I go to use this at the end to make her temporary crown up, it's not so bulky material going into the mouth. And then normally I'll just kind of wrap it in some wet just to keep it moist because we don't want any distortion or anything if it dries out at all. So I'll keep that, and then we'll be using that near the end of the procedure. And then I just usually just keep it over at the sink, and that's all for the temporary. Okay, Lorraine, Bob's going to come in now that we
Okay.
did that temporary. We can get going and prepare everything.
How's it feeling?
It's
Numb?
numbing, yes.
Numbing? It feels
Yes,
good?
Yes.
Oh, you okay?
Yes.
All right, so Marnie's got the temporary done, Lorraine, so we're going to actually go ahead and start working up in there.
Okay.
You okay? You ready for me? I went back and I had a beer and I'm ready to go. No, I didn't.
That wouldn't be good.
That wouldn't be good.
That would
See,
be
you're
good.
working on the wrong tooth. Okay, so let me get all set up here. So Lorraine, when we work on this, I think we might try rubber dam. Do you remember those?
Somehow I
Somehow?
remember.
Yeah.
I don't think it was really pleasant, was it?
Yeah, I don't think it's too bad. Well, let's see.
Okay.
If we can do it, great. If not, we'll do it without it. But this is just that net that goes over your tooth, if you remember that?
Yes.
Remember that? Let's see how it works. Because we are working on the 4 in a row
I
there.
just don't want to be gagging.
No. Well, this actually usually helps that.
Okay.
Yeah, usually a lot of people find it better. So let me just see how we do with this. Open again. How's that, Lorraine? You okay?
Mm.
Excellent. I'm just going to put the light here a little bit. See, one thing for sure, when I get in here and start working, you forget about the camera probably. Huh? You just think about me. So Lorraine, lots of stretching, and we'll see how I do here. You doing okay?
Mm-hmm.
Excellent. And that works quite nicely. You can see what that does with the rubber dam, how we isolate things. Marty, can I just cut a little breathing hole in there, please?
Sure.
Perfect.
Yeah, I'll get you.
All right, I might even try one of these little bite blocks if this works. I think I've used one of these on you before. Wide as you can, if you can. Close again, right up tight. It just gives you something just for your jaw. Are you okay with that?
Mm.
And let's give you a little breathing hole in here. So we can kind of peek back there all the time and see what's going on. Are you okay with that? I think we're ready to go. Okay. So Lorraine, what you're going to feel here when I work is just a lot of vibration. You should feel absolutely no pain, nothing at all. Okay, let's have some fun. Lots of vibration. Did we take a photo of this ahead of time? Well, you know what? I'll take a photo after I remove the restoration. Let's do that. Okay?
Yeah?
That'll be better.
Or maybe?
Let's do that after. Lorraine, you okay? Vibration only? No pain? Okay, anything at all, you tell me. Lorraine, you okay? Doing awesome. Perfect. You can see when we're working here how Marnie's actually blowing air in my mirror, and that helps me see much better. No problem, Marnie? Good. Start at number 2 here. How's that one, Ryan? Good? Yep. Doing awesome, Ryan. Ryan, can you put the x-ray up for me, please? If you would?
Yeah. There is a photo. That's the
Okay.
free photo.
Oh, we got a photo of the person. You good?
And I'll bring the extras over here for you.
Awesome. Okay. Excellent. We all good, guys? Okay.
You doing okay under there, Lorraine? You drowning?
You're good. I think you're doing good with that rubber dam on. Okay? Yeah, nice. You're gonna ask for it every time, right? No? Nope.
You don't love it that much, do you?
We can use it for your checkup too.
Thank you.
So that's not a good idea. Awesome, Lorraine. I like to load my own burrs when I'm working. I just find it easier in terms of sequencing and knowing what I want when I want it. So obviously doing a quadrant like this, you kind of take all the restorations out. So it's one of those things that doing everything at the same time really facilitates having good contours, everything you want as well.
That's good like that, Marty. I know you gotta work. Sometimes your hands look like in front of the camera. I know you have to do that too. Yeah, that's the best.
Okay.
Whatever you can do to help us.
Everything okay? Awesome. So I'm going to prepare the crown here. And I mean, for this one, pretty standard preparation all the time. We're going to do a zirconia crown preparation. So I always start with a round burr, and I define my buckle and my lingual or palatal margin first. And obviously loops with magnification. Here I'm going to put my headlight on. Okay, Lorraine? Beautiful.
Doing okay under there? No, it's a mouthful, eh?
I usually spider the tooth, if you know what that means. I mean, I would put my depth screws in. And peel the enamel off. Doing awesome, Lorraine. Still with me? I know as dentists we like to go into tooth world. So very important to understand at all times you want to be connecting with your patient, making sure she's comfortable, she's okay. Marnie does the same thing. Marnie, can I have another handpiece? Do you have another handpiece? This one, the chuck is slipping. Just going to change handpieces here. And when we retrieve anything in the drawer, obviously we use tongs. Just want to change my handpiece here. Burr's backing out, man. Lorraine, you okay? All right. Doing great.
Can you sign a script?
Is that man?
Can you sign a prescription?
No. I want to sign that.
Susan?
Still preparing the tooth. Lorraine, you okay? I'm always going to ask you.
You know, there's lots of water, Lorraine.
Good. We're getting there, Lorraine. We're working actually, Lorraine, on all 4 teeth at once here. So I'm just up doing the final preparation for the crown.
Usually periodically rinses whenever he takes a break to keep the site nice and clean. And remember to periodically look under to make sure that there's no water buildup underneath there, in the back of their throat.
I like to use this end cutting burr just to refine my margin at the end. Can I have a sickle, please? Scaling around the margins, make sure there's no buildup underneath. Okay, now I just want to do some final cleaning up of the preps, and we're ready to do the fillings.
Todd, do you want to take a camera picture at this stage?
Camera shot?
Yeah.
Yeah.
At this stage?
And I'm going to take this one up here.
Pardon?
I'll take this out here. The core buildup on this one. Some carries in the carry. Okay.
You want the camera first? Or do you want?
No, let's actually.
Because sometimes that leaves us such
Yeah,
a
let's do
red
that.
everywhere.
Let's take a camera shot.
Yeah.
Now we'll stop here and we're going to take a photograph. Now using the intraoral camera is a critical part of everything we do.
Turn the light.
Yeah, in terms of actually showing somebody what's going on, showing a midpoint in where we are. And actually at the end, obviously showing them the final restorations. Okay, that's good. And what we're going to do here now is to do some caries indicator. You okay, Lorraine? You're doing awesome. Is this bite block good? Are you doing fine? Yeah. Okay. You want to tell me how your summer's going and stuff? No? Okay. I don't know. I get lonely. I need to talk to you.
Now I'm
Always
just
remember
saving
there's
both
a-
at the same
there's
time. I'm
always a
putting them
person
into her
attached to these
file
teeth.
in Patterson Dental and saving those so they can't be deleted by accident. And I'll actually minimize so that he can keep the schedule up.
Okay.
Now we're going to use some caries indicating.
I use this a fair bit. I just like to make sure that I'm not just relying on my ability to feel caries. I like to sometimes go ahead and just wash it through with caries indicator to make sure there's no little bits of decay left. Good money.
And I actually leave the indicator paste kind of away from everything because it is messy. So I don't knock it by accident.
Use a round burr here to clean anything up. And one more spot there. Doing awesome with this rubber dam. I mean, it's really helping things. Marnie, on this, we're going to use 2 regular matrix bands on this, okay? You have those.
I have
You already
one.
have them?
You want
Yeah.
to?
I use 2.
Let me get one more out.
Randy, okay? Mm-hmm. Awesome.
I'm just changing the direction of the matrix bands so they're both facing for the first quadrant.
Okay. In this case, we're going to build 2 of these just with regular Toffelmeyer bands because we obviously don't need contacts on the mesial and distal of the crown, adjacent to the crown. So we'll do these 2 and then we'll use a sectional matrix later to form the contact between the bicuspids. Just a little easier. So what we'll do here is we'll do 2 And there's one area that we've removed some of the decay on the, and all the restoration underlying that crown. And I think I advise anybody when you're doing a crown to not leave any of the previous restoration in unless you did
I
it.
try to keep his x-rays up all the time
Oh.
of the patient's tooth as he's working in the procedure.
Okay, burnish her, we're good. And I use the burnisher to form those nice contact. Go to proximal surfaces again. Okay. So here we go.
Chlorhexidine?
Here we go with a chlorhexidine rinse. You see what Marnie does when she passes me something. She always tells me what it is because often I don't know. It's just a brush to me, but she always keeps me apprised of everything she's passing. Marnie's very clear about where she is in the procedure, so she actually knows exactly what I need and when I need it. I like to etch my cable surface margins always, where the enamel is. Okay, so now what we've got here, they're all cleaned up, disinfected with the chlorhexidine scrub, and we're ready to do some bonding. So at this
This
point,
is microprime?
we use a microprime, which is a desensitizer, and also it's antibacterial. And I use this really after I've done every prep and after it's disinfected, so to speak, with chlorhexidine. And I always apply microprime. It's very compatible with any bonding resin. We're going to air dry that.
This is a clear fill primer.
And now I use a clear fill. I still like the prime and bond as opposed to the one step in most situations. I've had great success with it. I see no reason to change at this point. I do use the one step in cases where I'm really tough to keep something isolated. Now here's an interesting thing. I always take my crown prep at this point before any impression, and I always prime and bond the surface of the entire crown prep.
Clear fill bond.
And the reason for that, now the bond I want to keep away from my margins on my crown prep, is there's no better time to actually seal off the dentin here. And the bond stays intact for 6 weeks. So it does enhance, and there's no better way to cure this than now, as opposed to when a crown is put on.
That for the crown. Score.
Yeah.
If you notice, I'm turning the material to the angle that he's going to want it when he puts
Did I
it
put
in.
it? I don't know if I put the bond on the 4, Marnie, but I just put a little more bond in there just to make sure. Are you all good?
Mm-hmm.
Awesome. Sorry to keep asking you.
Mm-hmm.
Okay. So Marnie will cure all that.
And I'm actually carrying the crown prep as well, where he put the adhesives on, as well as the 2 fillings we're doing.
Marnie, can I have some mineral oil? Yeah, here's a, no, I say let's do this first, Marnie. So let's just flow some, I'm going to flow some resin just in the area where I did the crown prep, almost like a little bit of a small core buildup here. Okay, let's do that.
You're just on the 6 there?
Yeah,
right
just
now?
a 6 for now.
Mhm.
So Marnie, let's go with some mineral oil on that. Now here's an important thing as well, because we have to consider the oxygen inhibited layer when we put this bonding resin on the crown prep. So what we're going to do is we're going to actually put some mineral oil on the entire crown prep and cure through that. So then when we take our impression, it's no uncured resin on the surface. There we go. So Marnie will cure that.
Mhm.
And let's go with our flowable. So now let's do our incremental buildups on these two teeth, and I use my flowable resin. I like the Beautifil. And we'll do several layers here. What I like to do, I'll do my mesial buccal increments first. And then we'll do the palatal, a little on the pulpal floor. Flow is amazing, this stuff. This is Beautifil. I don't know who makes it. Shofu. It's actually a very nicely filled hybrid, so it's very strong. You can use it as a restorative material on its own. Love to use this for abfractions. I like to use it for incisal attrition. Okay, Martin, I'm going to do one more layer here, and then I'm going to use the...
We're even the 5 right now?
Yep, still the 5. And this.
So I don't want to get in the way here, so I can't see you as well.
Yep.
More to the head. There you go.
And here's where we'll now use the Filtech. I like to use the Filtech Supreme. I like heliomolar as well. Just in my hands, Filtech is the ideal, turn that off. It's the ideal restorative for me in terms of handling. I can pack it, it stays where I want.
Is there
Beautiful
actually
polish.
A heater back here that I can keep the injectable material in. This is actually a Filtech Supreme that I'm using.
And the reasoning behind that is, you know, when you heat your compules up, apparently it facilitates light cure, PFI, and it also enhances, I believe, the ability to adapt it in the tooth. Once you start heating your resins up, you'll never go back.
You're in just the 7.
I've turned my overhead light off when I do this as well, so it doesn't cure the material. Not my overhead, but my headlight. Chris, the cameraman, doesn't like my headlight, so normally I would have it on the entire time. But he's been yelling at me, so it's all right. So Chris, are you called the cameraman these days, or what do they call you guys now?
Call me everything. Videographer, cameraman.
I don't know, it sounds like a movie or something. Anchorman, cameraman, the man,
Why don't you just call me the man?
the man,
The.
the man behind the lens.
Hey, and you doing okay under there? You swallowing okay under
Perfect.
there?
Okay, Mark. That's the 5.
Yeah, you got a lot in your mouth there, but you're doing amazing. What a good patient.
Awesome. And you can see this whole thing, how it's coordinated, and for the assistants watching this, you can see how important it is for preparation, for efficiency, for everything we do in terms of all the different movements and requirements that are necessary to do this filling. And it's like a coordinated dance, but it has to be done in terms of Marnie totally anticipates everything we need, where it is, what time it's needed in the procedure. And we've been doing this a long time. But now I'm going to go ahead and I'm going
turn off the
to
water when Bob's
I'm going to do some
polishing
shaping on this.
the teeth. You know, suction close by because there's usually a lot of powder. Just this way a little bit.
It's like a little mini construction site. Lorraine wants us to do a different construction site.
Oh,
I'm
kind of
sure.
put the section near his mirror. I'll kind of go opposite to wherever he is, so so that you're always trying to keep out of his way. And you don't want to try to go in front of his view of his mirror if possible.
There's no better time, obviously, to restore and to polish an interproximal than now. So when it's wide open, awesome. I use a series of Brasler multi-fluted burrs, 12 flutes, and then I move to the 12 flutes 6 flutes, and then I move to the 12 flutes. And again, every dentist likes different things, obviously.
A lot of times, things that I'm not going to be using anymore, I either get rid of the garbage or I'll move it over to the side. That way there's a lot less stuff going on during your procedure. And I always tend to put things back in the same spot so that we're not reaching for stuff and looking for things.
So I'm establishing the perfect contact on the 7 and the 5, or the molar and the bicuspid, to allow the lab to create an ideal broad contact on the crown. So that looks good. So now we're ready to move to the 4. In the matrixing here, we will use the sectional matrix bands.
What I do
And
is I
we will use a
usually lay
wedge
them
in this
out.
as well. And you see how Marnie works within my sphere here. In other words, when you get these loops on, obviously you don't have big, wide scope of vision, so she has to bring everything in close for me so I can see. And
sure.
notice here how she lifts that up, puts it up, and I just kind of grab it right off her hand. All these little tips will make things run more smoothly. Lorraine doesn't want me to slow down. I don't know if I like that. That wedge, I think that wedge isn't bothering me. So let's take this back again. I'm going to try this without this wedge. What I don't want to do, I'm going to use a different kind of matrix band here. It's one of these Garrison ones. Sometimes when you get a very large box-like preparation, sometimes these rubber Garrison ones do a really nice job. A little harder to position. You feel that?
Mm-hmm.
That's no good. Lorraine doesn't want me to use the wide Garrison ones. Is that better? Sorry. And then I can actually get the contact and then still place the wedge in. It doesn't drive the contact back. So let's, you okay, Lorraine?
Mm-hmm.
And there's a little space for the wedge in here. It's perfect.
There. Do you want to brush her again?
Yeah. And that's going to give me a really nice, solid, broad contact here for between the two bicuspids, and we're good. And now, Marnie,
Do
we
you want a little bit
want to
of bond?
rebond, okay? Because we've already done the prime and bond, so let's just rinse this. Now we already went ahead and did the priming and the bonding, but we just want to freshen this up again with new bond, because we've actually gotten, obviously, from the polishing and the water. And we will thin that a little bit. And go ahead, Lorraine. Lorraine, you okay?
Mm-hmm.
Great. I know this is a lot, but you're getting it all done in one time. So here we go again with the layers. Marnie, you gonna ask me for a raise after this?
Yeah, that's right.
Jesus.
Now I'm going out for lunch, supper with Lorraine. That's what we're doing.
Wow.
2 people for dinner. Lorraine and I.
I guess I have to keep you. It's been
Something fancy too,
Fancy?
Lorraine. Let's go
Okay.
fancy.
Lorraine's getting paid $1,000 to sit in this
At
chair.
Arby's.
But I'm charging her $9,000 for the crown, so it works out okay. Kind of works out. At Arby's.
Oh,
You okay, Lorraine?
do you need more, Bob, on that? In that?
Lorraine wants me to shut up and just finish.
Bob, do you need more?
No, I do, Marnie, yes.
Oh,
One more layer. I use my burnisher a lot when I do this kind of stuff. I just find it easier to control the Filtech. It's kind of my go-to packing instrument. Obviously, there's lots of different kinds. And one more.
Now, normally I could transfer with one hand, but because we're filming here, I'm going to just keep the left side out of the way.
It's good.
But
You're good.
normally I would come with this
Do it. That's fine.
and just transfer with one hand.
Yeah, I'm gonna take this off, Lorraine. Those glasses are falling down on you. Cure that again, Marnie. Marnie will come back now that I bend the matrix band back and clear from the lingual and the lingual and the buccal just to get those interproximal boxes cured. Nice contact there. Okay, now let's shape that
I'm
one.
going to do one more, a little bit more.
Lorraine, we're getting
now
close
that
to taking this
everything-
off. 5 minutes for taking it off.
Especially interproximally, because on that band in there, sometimes you don't get the light directly in there. So.
Awesome. No pain, Lorraine? Still good? I don't want to blow my mirror. Oh, you're holding that back? Okay.
That's okay. Trying to stay out of their view.
That's good.
Is that okay?
Yep, good. Normally when I'm polishing like this, Marnie blows
Yeah,
my
but
mirror
I'm
off.
kind of more.
We're keeping out of the camera's view, so. Alright, I think Marnie good with that. And then we're going to get ready to take a photo here, Marnie, just before we take this off.
So open up the camera, because now we're going to take a picture of the fillings done, even though the crown is just prepared.
I like these flame-shaped ET, I'm not sure the number, but the brassler burrs really allow us to get it in approximately. It's like doing body work on a car. Never finish waxing and polishing, I guess. Huh? Might be a good time, Marnie, to just go ahead and maybe take a camera shot on this. What do you think? Let's go ahead and do that. That way we can, I don't know if I've got them cleaned off enough or not. See what it looks like. It's pretty good. Let's try back here. That's good. Great. So Marnie's got the camera ready at all times, and Lorraine, I'm going to take that off. You okay? Yeah. You want to leave it on for me? No. take that, Marty, can I have a tissue, please?
Sure.
And we'll take that out of the Lorraine. You did
Yeah,
awesome.
trade you,
Are you
Lorraine.
okay? It's for you. How do you feel? Dumb question? Stretched? It's not. I know.
I feel wonderful.
Good answer. Now I'm going to really pay you $1,000. Okay, so we actually
Yes.
built up all 3 fillings. They were large ones. And now we've prepared the crown totally. So we're just going to go ahead and check the bite now, and then we get ready to take your impressions. So you've done really well. Close up tight. Bite your teeth tight, Lorraine.
I don't want to scale it too. You
clearance.
haven't scaled it.
Open again, Lorraine. Close right up tight on your back teeth. There you go. Just want to make sure that you're good. Try and close in your back teeth, Lorraine, if that makes sense. Is that where your normal bite is, right there? Okay. I know your bite is a little different. Open again. Close tight. Excellent. And let's go ahead and check this again. Open again. Lorraine. And close again. Squeeze, grind. Open again. Awesome. Okay, so let's just finish shaping this now. Looks pretty awesome. I use a scaler always at this point. I want to remove any flash that's around from the restorations. It allows me to get in interproximally at the seat of the restoration, the boxes, because that's usually where you get a little bit of flash, so don't be afraid to get in with a really sharp explorer. And I don't know what the name of this one is, but I'll write it down and give you a list. Makes me happy. Okay, so let's just finish with the polishing. To do that, I like to use the 12-fluted Brassler. I call it a football burr, but I'm not sure what it's called. Man. You know what the name of that is, Ryan? 12-fluted?
It's 74. Yeah. 7404 is the red.
Are you okay? Not bothering you?
It was this that was.
Sensitive?
No, it just jammed in.
Oh, I'm sorry. Okay.
Oh, did I get you? Mm-hmm. On the tongue? Maybe down below.
So make sure you don't jam the patient. Okay.
Your tongue's wild over
You
there.
get it?
I don't know what to do with it.
I know. You're doing fine. I'll keep your
Park it
tongue out
over
of the
here.
way.
Okay.
You know, you're trying to be helpful with your tongue. I know.
You're good.
I'm the same when I get my work done.
It's like saying don't blink.
And then sometimes when you do it, the more you think about it, then your tongue. No, your tongue. It's perfect.
I'll usually also use this 12-fluted one just to buff off any corners on the crown prep. Making sure that they don't have like the surface of the moon for the lab.
Close up for a sec. Rest your jaw for a minute there.
And now we're going to finish polishing with the dialites. These are the purple and the orange I like. These are great for resins. And then we can get ready for an impression. Marnie, we're going to be flossing this, Marnie, in a second.
I usually have floss ready. And I usually hold it out for him too, so he's not reaching. I hold it on either end and he has a good grip for the floss.
Excellent.
Ready? Now I'll bring stuff down now that we're going to be using for the temporaries. Get that ready for the crown.
Okay, and then we floss our nice tight contact. You can see how nice that contact is with that Garrison. I don't even know what you call it, the Garrison ring, is that what you call them? And we are ready for an impression. Lorraine, do you need to rinse? Or are you okay? Want to just take the impression?
Keep going.
Keep going? Good? Keep going, Doc. Good. Okay, so we're going to take an impression now. And Lorraine, would you bite your teeth again? Now, prior to taking an impression, you always want to look at the contralateral side and get that bite so the patient bites in the right spot. Now, I'm going to tell you, I always use triple trays, and for those of you who like full arch and don't like triple trays, you need to start thinking about using triple trays. Just do it right. I've been using these for 25 years, and I don't think I've had one distorted remake. So, something to keep in mind.
So what we're going to do that's a little bit different with this take one is we're going to actually be injecting a little bit into this syringe. That is a lot finer detail so it can get in. And once Bob's ready?
Yeah, ready.
Okay. So then what I do is I actually inject some of this in first. And I put it into a syringe.
And as Marnie's shown you there, I like to be able to control the light body material. I'm good, Marnie, you can put that over there.
Pretty good.
And I inject this with this tip, centric syringe tip, all the way around the margins, ring it around. I didn't have to use any retraction here. And I take the rest of the light body while Marnie is actually loading that with a regular blue mousse. I'll explain that in a minute. So the idea behind
It's actually a
this
classic instead of the super fast.
is we want to form an accurate impression of not just the tooth, but the bite. And I'll show
I
you.
actually attach kind of a little bit. It just gives a little bit more stability.
Cool. So then we're going to guide Lorraine in her bite here. Lorraine, bite your teeth right up. Bite your teeth together. Don't move your teeth. You're perfect. Nice and still. So while that's actually there now, I will take more of the blue mousse, and this is probably what stops the distortion, because this stuff sets like a rock. And I ring it around the tray, and that is important that Lorraine does not move her teeth. That takes about 3 minutes to set, and we'll be good. You okay, Lorraine? Okay. Nice
And I do sit her up a little bit.
So now I'll be running off
You
while
can take
Marnie
your
starts to
glasses off
take
for a minute.
over.
All right, you want to take a
And
break.
I'm going to do a check.
I'm going to
Okay?
go not all the
Good.
way up so you don't drool, but and
I'll
this is
scoot
going
out
to
of
sit
here.
now for about 3 minutes.
Okay, we're back again. Now we've actually gone ahead and made the temporary, and the impression worked out very, very well. So we've already tried the temporary in, so let's go ahead and we're getting ready to insert it. So Lorraine, the temporary is something you've had before. It's just temporary, so just, you know, it'll be pretty strong, but just really avoid the other side a little bit for the next while, and you should be pretty good. And you still will be able to floss it. So just be careful flossing up and pulling the
We're
floss
actually
out.
using a temporary cement called Telio, which cleans up very well. It's light cures. We actually will be applying the light to it. So I load the temporary for Bob. You don't have to fill it completely up. I do it about 2/3 full actually. And then what I'm going to do is I kind of try to line it up so it matches the
I mean, let's just light that up just a little bit, and so I take some of the excess. So a little tip here is Marnie just does a kind of a little wave cure on that, so I take this the other side too. It's easier to take some of the excess off, and then we'll do the final cure after. So that just cleans up a little bit easier, and Marnie just grabs that. These multi-brushes are great for all of this cleanup. We use them for everything. Okay, and then I use my sickle again just to clean any excess off.
Now I'm going to be
And
putting
then
more
Marnie
light
will
on
cure
it.
that.
Actually, now that a lot of the excess is gone, I can light it up a little bit more. I still try to avoid a little bit the interproximal, just so Bob can get the floss through. What I'll also do sometimes is I'll hold the temporary.
That's pretty good. I think on this one we're okay. Yeah, do you want to hold it again, Mary? Just the one up so I can pull it down. That's awesome. Okay.
And then now we'll go in and do even more on the interproximal.
And we'll go ahead and we'll check the bite one last time. Marty, maybe? Do you want to take a camera shot on this, Marty? Let's just do a camera shot before that. And just for fun, we'll take another camera shot of the final quadrant. Then again, pictures are always great just to show Lorraine what we actually did instead of explaining. And there's a picture of the whole quadrant. Excellent. And Lorraine, when you tap your teeth, tap tight. Tell me if the bite feels normal on your left side, where it's not frozen. Okay, great. You're awesome. You did great. Wasn't too bad, I hope, was it? One more thing. Actually, just it was wonderful. And this is something I think is a really good tip. We're going to use a light laser just for 20 seconds. Just put it on the injection site. This is a low-level laser. If you don't have one, you need to get one. We use it for most things in the office. It promotes healing. They're great for treating ulcerations. They're great for muscle spasm, post-op healing with surgical extractions, any kind of extractions. We use it for so many different things, and it's just incredible what it does.
Now I can go ahead and complete.
So that's a low-level laser. And we're done. Lorraine, you're awesome.
It's probably one of the most fun experiences.
I have ever had. Now that's a good patient. So I just kind of spin you around, Larry, just one time if I can. She says, I'm not out of jail yet. Okay, just want to show you what we did. So what we did here, and this I think is a very important thing to kind of walk Lorraine through. What I'm showing here, Lorraine, is after I took the restorations or the fillings out. These are the two front ones. Fillings are all gone. This is where we've cleaned it up since then, and this is the back one, and this is the one where we did the crown preparation. So these two here are now these two here. Aren't they nice? Mm-hmm. This back one here is now this back one here. And there's
So
the
how many teeth did you actually?
4.
Oh my gosh.
Nice. We could do them again. No.
No thanks.
So here, this one here is the
Wow.
last one. Now the temporary has been placed, and now you're going to see the temporaries here. Looks pretty nice. So there's the filling in the back, the temporary, and the 2 up here. So by actually changing all of those old fillings and doing them at the same time, we're able to shape them properly. So the temporary now that is going to be replaced by a crown, and once the crown is done, you're going to be good to go. So just to summarize what we did, and I'll just kind of speak to the camera here. Important when you're doing a procedure like this, the whole time we're in, you got to really make sure that it's not just about Lorraine's teeth, it's about Lorraine. You got to watch her comfort at all times. You got to make sure that you're not hurting her from the injection technique right through to the end. And I think the most important thing with this whole thing is just understanding what we're doing and why. And that's where the photographs that we take ahead of time and then throughout the procedure are really, really important. And obviously a patient like Lorraine is awesome. So that's it. You're amazing.
Thank you.
Thanks for letting us do this.
Thank you.
Okay.